Welcome, everyone, to another episode of Health Made Simple Show. I'm your host, Dr. Bart, and today, another great podcast. We're going to dive into some clinical insights. If you're new to the clinical insights, these are a couple cases that I have real-life experiences of patients that I see in the clinic or virtual during the week. And I share these with you because often, sometimes we don't think what we have necessarily will benefit other people to understand what we go through, and it goes back and forth here. So I share these with you because I think that there's a lot of people could benefit from hearing these conversations, kind of what we do about it, how we strategize, and then the end results. So I've got three doozies for you today. So the first one, I'm going to talk about a question that I think this is the first time I've received this question, and it made me actually pause for just a quick second before I can answer it. So listen closely when we get to that one. And then I'm also going to talk about ovarian cysts. We have a couple great cases. We're always seeing these. I want to make sure that you guys have some insights about what to do with ovarian cysts, since 50% of females will experience them through the course of their lives. And then also we're going to talk about this dude he's getting it on, intentionally doing some really, really hard stuff that I don't think most people would be up to, and I'll talk about that in just a moment. So anyways, folks, welcome to another episode of Health Made Simple Show. Appreciate that you're here. Keep doing the thing. Keep sharing it out. Keep spreading the love. We continue to get more impact, have more impact, and continue to get more feedback from you, the audience. And we love the feedback. So if you have questions, you have comments, even if you don't think I want to hear them, they're helpful. We listen and look at all our comments. So keep doing the thing, keep sharing out, keep spreading the love. All right, let's dive right in. Clinical insight number one. This is a question that I received, and it threw me off for a second. It was interesting. So the question went something like this. I won't have it down verbatim. This was a very healthy mom trying to raise very, very healthy children, and ran into some challenges, some complications, ended up in the hospital, a bunch of different visits, some really scary stuff, and the outcomes are still yet to be known. So, and maybe even some mistakes along the way. With that being said, no judgment there, but this is the question. The question was almost a question statement, was if medical mistakes, medical errors, the mistakes that doctors are making, mistakes that they're making, are the second or third leading cause of death in our country, which it is. Unfortunately, it is. 250,000, I think some reports say, of medical errors, not just people that die in hospitals. We're talking about the errors. So her question was, if those are errors and they're actually higher than all of the cases of any reason someone dies from a gunshot wound, whether it be a homicide or a suicide or by accident, whatever it may be, take all of those. Over 250,000 people a year die from medical mistakes, medical errors. So our question was, how is this fair? Why are we chasing guns when we have people doing things that just aren't good, and they're actually making mistakes and they're not getting penalized? Well, I didn't go through all the details there, but it made me think. And here's first things I want to share with you when I heard this question, because I think we do have to think. But after thinking, and in that conversation, I had to pause on this one and how I wanted to answer, because it was coming from pain. It wasn't coming from bad guy, good guy. She was in a scenario where one of her kids, there was a mistake made in it. It is having a very, very non-good situation, maybe life-threatening situation right now. So here's a couple of things I want to tell you. One, I do know that one of the reasons that there are so many medical errors is because we have so many people using doctors. That is true. There's massive amounts, and collectively, more good is done than harm. And at the same time, I would say, if we can clean up the errors, I think we should. And I think there's a couple answers there. I do not have a magic wand here, but this is what I would say to you. And I personally always believe in we need to have the beholding needs to happen for the patient, for the buyer. So buyer beware. We have to have a certain level of skepticism, a certain level of research being done, a certain level of conversations and questions that are taking place. So I want to take this in two different directions. One, I think we're utilizing the healthcare system way too frequently, and that's one of the challenges. That the doctors end up with situations, cases, people, patients, real human beings that are so medically induced, so drugged up, and so worn down that the health that's being expressed in their body is so minimum that it's very difficult for them to get these individuals healthy. So they're starting to take some additional risks. Maybe they have to go outside of a box. This doesn't fit in a box, and therefore we're calling those some errors. So there I say this is buyer beware. That means for us, the patients, all of us, you, me, everyone, that we have to be more responsible for the state of our own health when we go into these situations, understanding that they have certain tools, and the majority of tools out there are drugs and surgeries. And I think that conversation really needs to be had more frequently. Here's what we do know: that drugs and surgeries are risky. They are risky enough that it could cost you your life. And so for us to blindly say yes to this, or yes to that drug, or yes to that surgery, even if it is being recommended, and this is where I get some pushback. You think that, yes, I should just be able to trust my doctor. Maybe you're true, but do you just trust your car salesman? You should have some skepticism. You should have your research done. You should know when there's a drug or a surgery being recommended, do some homework. I am shocked, folks, on how many people will come back to me doing their homework on something like turmeric, but they have a pocket full of drugs in their medicine cabinet that they're taking on a regular basis. So one, I think it's buyer beware. And then the second part of that is that, again, I'm not suggesting or recommending that we don't go to the doctors. I think drugs and surgeries have their place, but I also think that we are utilizing them way too much. So do I think there's a correlation between that and guns? I think I'd rather not conflate those two conversations. I think it's an eye opener, though, that 250,000 people a year die from medical mistakes. I think that, again, we need to raise the bar. And then the other part, and I'm probably going to get some pushback from this, but the other part, one of the reasons I think that they do this, that doctors no longer have autonomy to do what they think is best. So I am a fan of most of the men and women I meet out there that are in the healthcare system. The challenge is they are in a system. They are stuck to what's called standard operating procedures. And if they go outside of that box, even if it's what they think is best, they will often be in trouble for doing so. So therefore, we are stuck doing things, unfortunately, not necessarily in the patient's interest, but rather more statistically in the interest of what's been done before and staying within their lane, if you want to call it. So I wanted to bring that one up because interesting conversation. What would I like you to take away from that is this. You're responsible for your health. We hire a team of medical professionals to support us in our health journey. Yet if you show up on that team and you are out of shape, I think you're showing up for the baseball team or the football team, and you are years out of shape and you are not ready to run a lap or a sprint and you get injured doing it, that's on you. It's not on the coach. It's not on the players on that team or on the people that are recommending you do certain things. So it's no different when you show up in a hospital. Man, show up prepared that if you have to do something extreme like have a surgery, that you're prepared, you're fit for it. So I don't want to go on a soapbox here, although this is worthy of a soapbox. If you don't want to have a medical error done for you, guess what? Stay out of the system. All right, moving on here. And to number 2 here, and this is a pretty cool case. 20-something-year-old female comes into my office several months ago for back pain. And of course, back pain being caused by so many different things. So we do a detailed history. I get to know them. That's what we call personalized medicine. In this conversation, yes, she's at her chiropractor for first visit for her conversation about her back and neck pain. She has a couple kids, tall, lean, and, so sometimes that structure, holding babies and nursing babies can be tough over time. Anyways, in the history, we go a little deeper into the conversation, as we should. That's personalized medicine. We start talking about her cycle. And then she tells me that it's awful. In fact, that she just went and had an ultrasound done, and they discovered that she has a 6-centimeter cyst on her ovaries. So this becomes part of her health. Does it mean that as a chiropractor, I should not be addressing cysts? Listen, I don't treat cysts, all right? And no chiropractor does, but we do treat the overall function of the human body. And sometimes that gets lost in when we start to throw around the words holistic or natural or whatever you want to call it, that we're trying to treat the entity, the human being, versus just the symptom. And so if I can backtrack this a little bit and just kind of talk about cysts in general, about 50% of the women out there will experience cysts. We see a high frequency, especially after young women, have gone on the pill, which usually could even reduce a cyst, yet creates dysfunction, disharmony between the ovary communication to the brain. And then after they come off of the pill, somewhere down the road, we'll see a higher frequency of cysts. And that's because there's been a dysregulation of how the mind and the body get to talk. So in this scenario, am I treating cysts? No, I am not. Really, what am I doing? Treating the systems, organs, or glands that make up this beautiful human being's body and makes up their health. So what do? We focused on the very things that are having dysfunction. And that really is the ovary. And in this scenario, really, and so there's a lot of reasons you have cysts, but fundamentally, the follicle isn't releasing the egg fully, and the egg sticks around and fills up with fluid, and that's your cyst. Oftentimes, that cyst will burst on its own, very, very painful, and may cause back pain. And that's how these are all connected. Not uncommon that chiropractors will see women who have a frequency of low back pain caused by cysts. So here's the cool part. She comes in a couple months later, and we do what we do, meaning this. We make our dietary suggestions and recommendations. For those of you familiar with cysts, we also know that there is a direct correlation, especially things like PCOS, polycystic ovarian syndrome, that there is a very specific correlation between diet and these different cysts. What diet is that? High carbohydrate, high sugar type diets, frequent eating, insulin resistance. So we go just the opposite end of that. So we essentially made a protein-centric diet she was all about, which I wanted her to put muscle on anyways. So protein-centric diet, clean foods. We got rid of the tough things. And I mean, they're tough because we got rid of things like gluten, the bread, the muffins, the pastas, the pizzas, all of that stuff. And you might be thinking, well, no, I don't want to do that. That would be too hard for my life. I would die if that happened. No, you wouldn't die. You, in fact, should become a better person. You become more in tune with your body. Your body would be thankful for you getting rid of all that crap out of your body, all that pro-inflammatory stuff. I don't want to call it food, but that stuff that's coming into your body that has a bunch of binders, a bunch of other chemicals in it. You get rid of that stuff and your body starts to work better. We support her with a very hefty protocol, very specific. I'm not going to mention here today because I don't want to get caught into the loop of giving what they would perceive as a treatment on my podcast here today. But I'll tell you very specifically, we gave nutrients, we gave some desiccated materials, very specific for the ovaries. We gave some protomorphogens. So it's very special herbs like chase tree, phenomenal to help increase the body's natural production of progesterone, because often there is a imbalance between progesterone and estrogen. Usually it's a version of what we'd almost say is estrogen dominance, or more often I'd see it's a deficiency of progesterone. And sure enough, a couple months later, she came in the other day. We hadn't even had that conversation for a long period of time. We had her on that protocol for about 90 days, and she went back. She went back on another ultrasound. I didn't know she was going. After I got her adjusted, she was leaving. She says, "Hey doc, I want to share something with you. Remember that cyst?" And I gotta be honest, I didn't remember in the moment. And then I was like, "Oh yeah, that's right. You had that big old cyst." And 6 centimeter cyst, folks. That's when you get to that 5-6 centimeter category. You're starting to have the conversation about surgery. And again, and that just opens up a can of worms. Like there's a lot of risk that goes involved with that. Anyway, she says they did an ultrasound and it's gone. And the doctors didn't ask her. This part was a little interesting. They didn't ask her anything about what she's been doing or how. She wanted to share with it because she was so excited and knew that the doctor had already explained that there's so many women now more than ever, or in the doctor's words, now more than ever, that she sees women with really, really bad cysts. And she wanted to share that information, but that window was not open for her to do so. So anyways, for those of you out there, whether it be yourself or anyone else, reach out to your functional medicine doctor. Reach out to us. We'd be glad to help you. We've helped literally, I don't even know, hundreds, maybe 1,000 women out there with cysts. It's very treatable. It is something that we have a lot of success with by helping your body get back to being the best version of itself. And as a result of it, the body heals itself up. All right, we got a little bit of time left here. Let's get into this third clinical insight. This one's interesting. I really, really love this one. And this is I'm just going to call him a 40-year-old stud. I think he's around 40. I take care of he and his family. His wife comes in and tells me and says, "Hey, do you know what so-and-so is doing?" I said, "No, what's he doing?" I said, "Well, he's doing this long fast, and I don't agree with it." Now he just has my attention. Well, how long is his fast going? He's like, "Well, he's going to come in here later this week, and when he ends his 28-day water fast." And there's part of me, I'm like, geez, like what? I didn't recommend it, so I don't, don't be yelling at me. Do I think there's a time and a place for a water fast like that? Yeah, absolutely. And I'll share when in just a moment here. So anyways, gentleman comes in a couple of days later and his wife wasn't happy because she's listening to all the noise, how dangerous it's going to be, what can go wrong. So I asked him, what was the why behind this? Because this is no easy task. I don't even want to know the symptoms during it. I want to know the why. What makes you sit down and remove what most people find the majority of the pleasure in their life comes from food and alcohol. And if that hits you wrong, I apologize, but that's the truth. The majority of people in our country, the glory that they have, the most happiness they have, and if we just accumulate it all, is coming from food and alcohol. And I asked him, so what made you think that taking this out for 28 days was going to be a good idea? And he was crystal clear on this. He said, the road ahead is going to be tough. I've got to bring my family through some things that I don't even know how it's going to happen. But we need change, and I know it's going to be hard. He has a very, very strong set of faith. And he talked many verses in this moment. He shared many verses of the Bible with me. And he's talked about suffering and how in order to move ahead, in order to gain, to push forward, to fail forward fast, suffering is required. And he decided that he was going to suffer to find his truth. And so when the tough times came for him and his family, that he knew he could stand on his own 2 feet and push them forward. So for him, it was a 28-day fast. And I think when we really look at things, especially when we look at biblical moments or just in past history, we see that fasting was always something that brought people to the light on the other side. Is it comfortable or fun? Absolutely. Just the thought of a 28-day fast, I'm being honest with you, for me, I'm like, it's terrifying isn't the right word, but holy moly. It'd be like this thrill ride, I think, of just toughness and grit and mental clarity, most likely in a beautiful place of spirituality along the way. But I want to have a couple conversations about this, because I think there's more to it than just saying, oh, he did it for a spiritual reason, because that ultimately was his reason. But I want to talk about how seeking comfort, and we do it through food and alcohol, no doubt, seeking comfort may be the fastest thing that ages us. Maybe the thing that creates the biggest decline year on top of year. And I'm talking about even on the small scale of things. So we think, well, I don't seek comfort all the time. Yeah, we do. So think about just the hot, cold thing. So we're here in Florida, got cold for a couple of days. You would think that hell froze over. People got wacky. So it dropped down to the 30s for a night. And it was like, holy moly, that's all anyone could talk about. It's too cold to go outside. People stopped walking, stopped exercising outside. And you think, that's those are just extremes. People don't do that. Sure they do. The summer comes, it gets too hot. People don't exercise outside. And then inside our houses, it has to be a particular temperature, right? It has to be between 68 and 72. We are creatures of comfort. And that to me is also a sign of our demise. It really is. There's nothing comfortable about intermittent fasting. There's nothing comfortable about making a food decision every single day that gets you away from carbohydrates and sugars, the things that are just blowing up and flameless. Because it's a lot more comfortable to sit down with a beer and pizza than it is a salad and some grilled chicken. It is. It's just a lot more comfortable. And it's probably more yummy in the short term, but it's the long term that we're talking about. So I'm going to encourage everyone to look around and see where you're getting soft. I just passed my birthday, and every year I ask myself the same thing. What's the next thing I have to tackle? Where do I need to get uncomfortable so I can move forward? And I got some answers crystal clear, and they're not comfortable. I'm still sitting on them, still grinding them away, because they're going to be uncomfortable, unfamiliar. And you've heard me 1,000 times here on this podcast say to be healthy, physically, mentally, and spiritually. It's going to be inconvenient, uncomfortable, and unfamiliar. So a shout out to my 40-year-old dude who put himself in probably one of the most miserable scenarios that we collectively could think of. And that's no food, no drinking, water fast. No, I'm not recommending it, folks. There's a time and place. When is that time and place? And I'll walk down that road, because this is the real reason I wanted to bring this to you. In our country, there's 1 out of 3 people who are going to face cancer. 1 out of 3, folks. That's a brutal statistic. Right now, we know still one of the most effective treatments, if you want to call it, or therapies, whatever you want to call it, for helping us to beat down those cancer cells is fasting. And so I am right now helping quarterback many people that have cancers. It's been blowing up. I wish it wasn't true, but I do believe that over the events the last couple of years, we have a situation, we create a lot of turbo cancers, and I'm seeing very healthy men and women are experiencing cancers much earlier in their life. And the good news is they're open to alternatives than just the traditional routes. I'm not saying that you don't take the traditional route, but they're open. So I quarterback that for a lot of people. I mean, we bring it all together, because if you've ever been in that scenario, or have had a family member that has been diagnosed with cancer or a neurodegenerative disease, you realize very fast that there is no quarterback out there. There's not a person that's helping you lead the way here. So right now I provide my services and help people quarterback, which means that I help them with their nutrition, their exercise. What about this? What about that? Answer all their questions I can. I talk to their doctors if they're open to those conversations. So I'm quarterbacking a lot of people here. And this is what I tell every one of them that has cancer. We're going to get you strong enough, healthy enough, clean enough. And then we're going to go to work. And we're going to go to work utilizing fasting. 24 hours, then 48, then 72. And if need be, we will go longer. We will continue to do this. So the strong cells survive and the bad cells, the weak cells die. And so for that young man, the 40-year-old stud, that's exactly what I talked to him about. I said, man, you don't know it, but you're practicing for something that's going to you could face down the road. And if we're not practicing for it, the moment it gets there, the likelihood of us being successful, let's just say that, you have an opportunity tomorrow to be playing for the New York Yankees. That's a baseball team for those of you guys that don't know any sports out there. Let's say you're in the bottom of the ninth, the bases are loaded, you're down by 3, you're up, it's a 3-2 pitch, and you get an opportunity to hit the home run and be, the star and all your dreams come true. If you've never practiced in that moment, good luck. Even when you do practice, good luck. But if you've never practiced, you're going to have a harder time being successful. And listen, tough times are coming. And I don't say that from a pessimistic position. In order for us to have really good times, we have to go through tough times, and we know that. So to all of you who are thinking about this upcoming year doing something tough, at bare minimum, I'll give you an example. We do a cleanse in January. So this will be my first opportunity to share with you. In January, we're going to kick off another cleanse, and we continue to ramp up on how effective we're doing this with. This is getting back to fundamentals, even though a lot of people are doing a lot of good things out there just to lose weight and stuff. But I'm talking about fundamentally eating like real humans eat. And for a lot of you, that's a challenge. Could you eliminate junk for 10 days, for 21 days, for 30 days? So I'll invite you to come join us. A lot of people, just the idea of giving up their alcohol for 10 days, to give up their bread, muffins, pasta, crackers, and you'd be blown away by the excuses I hear. Well, it's football season, and it's my brother's birthday, my dog's cousin's dog, whatever, is having a birthday, and I gotta have a blowout, whatever. So if you haven't done anything hard in a long period of time, I don't necessarily recommend doing it right through the holidays. Yeah, that'd be a pretty tough time to do it, and that would certainly be awesome. Yet, right after the holidays, it's a fantastic time to do it, to hunker down, do something a little tough to set yourself up to win next year. All right, folks. Well, that's it for my clinical insights. Hopefully you enjoy these. Hopefully it hits home for you that gives you a little inspiration to do something a little bit better for your health. And if it makes sense, go ahead and share this with someone that might know where these might sit good. Maybe it's about a cyst. Maybe it's about doing something hard. Maybe it's a little bit about that statement of, listen, we can't always rely on drugs and medications or drugs and surgeries to help us heal because there's always risk involved. With all that being said, keep doing the thing, keep sharing out, keep spreading the love, and continue to make sure you're taking deliberate action for your mind, your body, overall wellness. Y'all be awesome.